The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Thanks for joining us with the second half of our year-end legislative update. Because it's the second part, my great co-host Ralph Boehm has allowed me to be the host on this one, so I'm quite excited. Thank you.
Thank you, Ralph Boehm again. And Erica, you got the floor for some stuff that was done this session.
Yes, the House with the cooperation of the Senate delivered a lot of really, really good things to New Hampshire. We're still waiting to make sure that the governor won't stop any of this great progress, but we have some really, really, really good wins. So last year we delivered a fiscally responsible and balanced state budget, and it's a $13.5 billion budget. So that's a lot of work there. But we cut spending, and we built the rainy day fund to almost $160 million, which is the highest in state history, which is great because it looks like things are going to rain because we are in a recession at best right now. Well, a recession, let's just call it that. I'm an economist. We predicted 20 of the last 2 recessions. And so we've had a lot of money that went back to municipalities, to our towns and cities. We did a lot of that this week. We cut rooms and meals taxes and increased the amount going to towns. And so a lot more money is headed back to towns from rooms and meals. There's about $16 million in grants for wastewater projects. There's $83 million for highway block grants, including bridge aid. There's another $60 million in bridge aid. And then we just sent a bunch of one-time payments to offset some of the retirement payments that are done by our towns and cities. We have the money in the budget this year, and our intention was to give that to our towns and cities so that they could cut your property tax bill. Unfortunately, it sounds like some towns and cities aren't planning on doing that. But that's why last year in the budget, when there was that money that we wanted to make sure was going to reduce property taxes, we put $100 million into the SWEP, the statewide education property tax, so that wouldn't come out of people's tax bills. So when you get your tax bill for July 1st, and when you get your tax bill, well, whichever, the summer one and then the winter one, when you get those tax bills, take a look at them because it's going to be lower. We actually did deliver property tax cuts, even when most of that is in the hands of the towns and cities. So I think that's been a huge win. And we're also helping out our veterans, which is great with Memorial Day this weekend because we're honoring those who gave all. And we've defined that veterans are the definition more appropriately encompasses veterans, and that helps them with their property tax credits, which is wonderful.
Right.
We've cut taxes.
That's why mine went down.
Fantastic. Did you recuse yourself? No, with that, so that was a bit of a joke, but that impacts every veteran the same. Right. And our job there is to represent the people. And sometimes that is a group like veterans. And you have to vote on those ones that you know about as long as you're not impacted more than others.
Yeah, and then I mentioned this a couple of shows ago with the Litchfield Veterans. What we did, I mean, all the flags you see up, like on Pinecrest and Hillcrest, were put up by the veterans. The big flag poles, the lighted flag poles at the 2 cemeteries, that was put up and paid for by the New Hampshire veterans. So yeah, we got the tax cut, for veterans, but we've probably spent more than those tax cuts by the veterans doing fundraisers and stuff. They just had a big fundraiser on Tuesday, a golf tournament, which I couldn't go to, but I don't play golf anyway. But but a golf tournament that brought in a bunch of money, so the veterans can do more stuff like that in Litchfield. I think one of the things they're coming up with or doing it for is a scholarship, for students, so graduating. So,
well, and that's why our veterans are so wonderful. They've learned how to be great and keep being great, right, and just really contributing. We also got rid of the dividend tax, so now we're actually going to be income tax free once that finally rolls out after 5 years.
1/4, yeah.
Yes, it's going to come through. And so there's so many other huge wins that we provided for the people. $82 million in school building aid. We had Another $8 million for mobile crisis units and community mental health programs, which we know just how important that mental health is. We have some other ones that cut some red tape to get people in. We defended personal liberty by making it so that the state hospitals and medical facilities will grant religious and medical exemptions to their employees so we don't lose them. Because that's one of the areas. We weren't able to deliver that for private employers, but at least we did for people that work for the state, and that's a huge win. And we slammed the door on vaccine mandates because we made it so that states can't demand that businesses check for vaccination status. That's just really important because New York City had McDonald's being their enforcer. So just as we look at all of these huge wins, we have election integrity. We had a clarification of the checklist. I'm actually jumping over what Ralph's going to say later.
No, I mean,
but it's fantastic what we've done, and it's amazing that we've delivered so much for the people of New Hampshire with such a tight margin. I wonder how much of that is just because we just had to get to that point of agreement so that we could deliver it and just come together as a team. And I think that did a lot. So,
good.
Yes.
Okay, some other stuff that we've done. Okay, HB 1280, that's in the case of a divorce or something. A parent's refusal to vaccinate cannot be used as evidence against one of the parents or the other. I mean, a big one, HB 1178, prohibiting the state from enforcing any federal mandates or executive orders or anything restricting right to bear arms. So if you can't use now, and interesting, which brings up a point about Texas, and I covered that a little bit, but they're still looking at how that happened, why all those kids got killed and a teacher, and starting to look like similar as the Broward County. And why did the police take so long to go in, even though in their law it says they will smash in immediately, but they were waiting outside. So that's still coming. So anyway.
I mean, obviously the murderer is the one that's responsible, but it's just such a shame that the police didn't go in and the parents weren't able to go in and get them.
Right.
So we need to look at the whole situation as we learn more.
And also too, I like what the media does and whatnot, and the government too, when they say it had an AR-15. They think the letters AR stand for assault rifle. It doesn't. It stands for what the gun is made out of, armor light. So that's what AR stands for. It doesn't stand for assault rifle. Also 1311, we increased teacher credentials. What a little bit more on what's needed to become a teacher. And also, part of that was also one of the problems what was happening. People from out of state get credentialed in New Hampshire and never even work in New Hampshire, but they're credentialed, so they go to another state. So this somewhat tries to tie together all the different states, what they want for different credentialing for other kinds of offenses, drugs and whatnot that might not have been. I mean, it's interesting, sort of tying to credentialing with when you go apply for a school job. You do a background check. So the credentialing also includes the background check now. So it's up to date. Also, students with disabilities, we did this a couple of years ago, but unfortunately when we had these bills at the end of the last term, then they got all tied together because of COVID and they sort of got dropped. And the one the federal law says, and it was kind of vague in places, about if a student's got an IEP, they're on a disability, say for a student that I know of that had Down syndrome, the federal law says 21. Now that was taken differently by different states. Some states said, okay, until age 21 is over. But New Hampshire took it as, okay, as soon as you hit 21, that stops. Well, that's been changed now till age 21 until you graduate, up to really goes up to age 22. That's it, that's when it stops. So I knew a family from Bedford that I had worked with a mother many years ago, and they moved for her daughter so she could, to Tennessee, so her daughter would be covered for that year. Yeah, but yeah. So now it's back to what the federal law and basically what happened was there was recently a case in Rhode Island where they ruled that it's got to be up to age 22. When 21 is finished, not when it starts. So anyway, that's good.
And is that one where they're 21 at the start of the school year?
Yeah.
So, that they're...
Well, what
like
was
that.
happening too, if you hit 21 and say January, that's it, goodbye.
Mid-year, you'd get kicked out of school.
No, but no.
Yes, so now that's fixed.
So that was fixed. I mean, it was, and people were saying, well, it's going to cost us money. And not that many students, not that much. Anyway, and a lot of school districts were doing it anyway. Yeah.
So here's one of the good election integrity ones. This was House Bill 1467.
Right.
So we get a lot of recounts of state rep races. That's because they're generally smaller, especially in small districts, and it's a lot closer. So you get a lot of these because people are able to get the volunteers and get out there. It's a lot harder when you have these statewide races because while in one town it might be close, that's not what allows the audit, and you don't really know what's going on at the top of the ballot, and people do have questions. So what this does is it makes it so that when there's a state rep recount, there will be an audit of some of the other offices at the top of the ballot, just so we can make sure the votes that were cast are the same ones that were recorded when we're already in there recounting the state rep race.
Yeah.
So, that's not a statement of what happened. It's just a statement of let's make sure that our elections are as good as we hope that they are and believe they are.
Right. There's another bill similar that requires the state to, Secretary of State randomly pick 6, I think, districts, towns, and whatnot across the state and do a complete audit of their. I mean, it won't be hand counting; they'll be feeding him in just to see if the counts come out right.
And that's a great one too, because you have one that's using hand counts, and then there's another one using the machines. And if the machines end up different, we need to figure out why.
Yeah.
So it's nice we have 2 different paths.
Well, I look at it this way because I've done both. I mean, when I was a selectman, we were hand counting, and sometimes 3 or 4 o'clock in the morning. Now, it's on a Tuesday, people work, so can get enough volunteers. So that was when I was a selectman, we looked for getting the machines. And Bedford and Hudson had them, and so we looked, and hey, they were great. And I think that actually machines in some cases are probably more accurate than hand counting if they're used correctly. And that, we covered this before, so that's the big issue in that. Also, here's a good one for you.
That's one that's definitely near and dear to my heart. That's House Bill 1022. It's the dispensing ivermectin over the counter. So we worked with the Senate on this, and the biggest part is this is really a harm reduction bill. There are a lot of people who are getting ivermectin, and when you get properly manufactured ivermectin, it's very safe. The only question is how much it helps, and that should be left up to the patient. But if you're getting ivermectin from India, or if you're getting it from Mexico, or if you're getting it from the farm store, and especially the farm store,
It's a horse medicine.
Yeah, it's a horse medicine, but it was a people medicine first, I
Right.
think.
Oh, yeah.
But with the horse medicine, when you buy it in horse medicine form, sometimes there's another drug along with it. And so you're taking a different drug alongside, and that can be really harmful. So if you heard about anybody who had problems from ivermectin in some of these states, it's because they're having ivermectin plus something else that's a poison to humans. So this is a risk reduction bill, and I really hope that the governor will sign it, because this bill is really going to help people in New Hampshire, especially if we end up with more waves. This isn't going to stop anybody. This isn't going to change what anybody does for vaccine. It isn't going to stop anybody who's still sick after several days from going to the hospital. What it does is it needs to be used early if you are going to use it. So early on, maybe you'll stop it right away.
Yeah, similar to what's the drug people take for when they get the flu?
It's not flu.
I can't think of it either.
But there's the Theraflu? No, that's the over-the-counter.
Yeah, it's an over-the-counter. No, it's a prescription.
No, there's a prescription one, but there is a flu medicine that you have to take early,
Right.
and it only works early.
Right.
And actually, Pavloxid, which is the one that was approved to use for COVID early on, that one only works early too. We actually look to try and find a way to make it easier to get that early on, but I think the study committee that's part of that ivermectin bill will go a long way to figuring out how to make sure that people can get Veloxid fast too, because if you can't see your doctor for 4 days, just like with the flu, you lose that early treatment window.
Yeah.
So it's a really nice approach, and it's very balanced.
Yeah, and no guarantee, because a lot of people are saying, like my granddaughter, no, that doesn't work, it's bad and whatnot. But no, hey, it's your choice.
Well, so the drug approval process is the biggest thing is making sure that it's safe enough for the benefit it gives, and it's safer than Tylenol, so hopefully it works. And you're only taking it if you think it does.
Right.
You're not going to force anybody to take ivermectin. Right. So let the people who want it get safe U.S. manufactured ivermectin, and let the people who don't want it don't take it.
Yeah, so similar, go to the, it's just like birth control pills and those kind of things you can.
But birth control pills kill women with blood clots.
I know it.
So they're dangerous.
So that's just dangerous too.
But like Narcan, because Narcan reduces risk, it might increase risk-taking behaviors.
Narcan.
But that's the same argument people are making about vaccinations.
Right.
So we need to make this available to people.
Right.
So we have a couple other interesting ones I was involved in. House Bill 1455 is the one that the state won't enforce federal vaccine mandates. It doesn't get in the way of a business who's doing it themselves, but the state won't be the ones taking action to do that. And that's the thing. If the federal government's going to do it, they should pass their laws and they should pay for it, because people of New Hampshire pay enough money to DC. We don't need to be using our money to be the enforcement arm of the feds.
Right. It's called also the 10th Amendment of the Constitution.
Yes. And I hit on that one there.
Right.
And then now we get to the Immunization Registry. It feels like this is COVID, but it's really not. We approved the Immunization Registry back in 1999.
And before COVID.
It finally got up and running. We were one of the last states with the Immunization Information Service. And we got up and running because of COVID. So anybody who was got a COVID vaccine from the state, they were automatically in that registry. And also, if you're getting it somewhere else, you need to know if you're opting in or opting out. When I was with somebody when they got their vaccine over at a Rite Aid, and they actually weren't really sure how to handle it. So this is why it's important to make sure that you are either opting in or opting out, and I'm working with public health to make sure that nobody's dropping the ball there.
And another one, 1487, withdrawing?
Yes, 1487. That's one that went to one of these committee of conferences, and I had the opportunity to be the chair. So I got to run a committee with senators in it. It was a lot of fun. And it actually was a lot of fun, because we recognize that people are the ones that are responsible for their own medical records. The Immunization Registry provides a great service, because between schools, summer camps, it has all of your child's vaccination records. So if you want the state to maintain it for you, the state is happy to do that. But not everybody wants the state to maintain those records. I know that I have the records for in case my child's kidnapped. I have all of that information at home, but unless I need to ask the state for help, which as long as I don't need to ask the state for help, I don't need to give all of that biometric information over for them. So if you want to maintain your kids' vaccine records, you can. Their doctors still have all of those records. And if you want to maintain your own, you used to have you currently need your doctor to sign off. So the new language here says that any doctor or the parent or the patient, assuming that the patient's an adult, can sign a form that has to be notarized if it's not a doctor that's involved, just so you understand what you're doing. And the form is going to tell you that it's your responsibility. So this actually was one of the big wins that came out of the committees of conference. Apparently you don't always walk away smiling, but we were able to here. And it passed the House, and I hope it has a good path all the way through.
Yeah. Okay, another big one, HB 1040. Establishing committee to study revenue alternatives of the roll toll gas tax for road improvements. Now, all the road improvements in the state come from two things, even a toll like at the Everett Turnpike and the gas tax. That is it. So, if you have an electric vehicle, how are you paying for the road use? You're not. So there needs to be a commission to study how to go about doing this. And it might be something to do with the registration for electric vehicles. But how do you pay? So where the money come from for doing your roads? Right now, in the Constitution, it pretty much says the road toll, which is the gas tax. And like in the Everett Turnpike, those kind of road tolls. So what's going to happen? We put a toll on every road? I mean, now, in other states, for example, a few years ago, I drove down to Maryland. And there's roads there with, just like you have in heading to Concord, with the auto toll. They have with no toll gates at all, which are doing away with them. They'll send you a bill, and no matter what state you're in, more, and just for what you use, but their tolls are a whole lot more expensive. When people complain about the $1 or 70 cents if you have the Easy Pass, but in some states it was like $5 for a small piece of road, and those weren't major highways like America. It was just a regular road. They had the toll on it, and they send you a bill. Massachusetts does something on bridges. You can go through, they'll send you a bill in the mail. Not a fine, it's the same bill. Same way in Mass, you go onto the website and you pay it. I don't know why they don't do other states do, but maybe because it's only $1. I'm not saying increase it, but So anyway, that could be a problem. So that's something, hopefully, how do you do it? By the mileage you've driven or what? That's something the commission, because other states got to have the same problem now. And then 1097. You remember when we had the COVID and people were worked in Massachusetts, but were working for home? And Massachusetts said, well, you still have to pay your state income tax. Even though when I was living in New Hampshire for a few months before we my company moved up. I made sure when I wasn't in Massachusetts, I was deducting that. Yeah. And that's the thing too. When I worked on Wall Street, except the years I was on the trading floor in San Francisco, I was working in Boston because that's where most of healthcare is. Yeah. And so I was going back and forth. They ended up not having an office for me at one point. Right. And it always used to be the law in Massachusetts that if you were working remotely, if you're working somewhere else for the convenience of your employer, which it is when they're shut down, you didn't have to pay the Massachusetts income tax unless you're in Massachusetts. But this one, Massachusetts deliberately passed, no, we want to collect anyway, and they took it to court, and actually won in the court. But this is a law saying taxation of income of New Hampshire residents working remotely at home, we're going to fight it. The state's going to fight it. Yes. Okay, so...
And that was one of the big things I campaigned on, so I'm glad we delivered. It says if you perform it all in New Hampshire, no other state can tax it.
Right, yeah. And it's interesting, and I don't know what happened to it, but remember, I can't think of the name of it, when you buy something online from another state, you have to pay their sales tax. But that's not being enforced anywhere, because there's something like how many thousand different sales taxes across the country. Now my thing, the law should be on that is, fine, in Illinois, if you want to collect sales tax of somebody buying something from New Hampshire, you come to New Hampshire and figure out what that's going to be. Because, you got the city taxes, you got the county taxes, you got the state taxes. New York City, New York the same way. How are you supposed to figure that out? So it's really not fair, and it's funny, even though the Supreme Court said it was illegal to do, nobody's really done it. Yeah. Because I think they're going to find out they're not going to get any business. Yeah. So, anyway, so anything else you got?
We have some other wins too, so we have some more time to talk about these, which is great. So one of the things we did in House Bill 239 is we increased the statute of limitations for minor victims of assault, which gave kids who were victims of assault more time to come forward and make it so that the people who hurt these kids will be accountable. So that's huge. We put $500,000 into the Internet Crimes Against Children Fund. We invested in Granite Shield, which works on drug trafficking interdiction. And we gave more money for police-borne and dashboard cameras, which is really good. because you
Oh,
want to
yeah.
know what actually happened.
Right.
It's always good to know what actually happened.
Yeah, that's
See,
right. That was a good
yeah.
one.
Yeah, we increased the enhanced penalty for those with a prior conviction for driving under the influence, but we didn't get bail reform. And the reason wasn't that people, it wasn't that we didn't see all of the flaws that are happening now with somebody who's just coming out and just assaulting their same victim again. It was because one of the ways that they were trying to address one of the loopholes, they ended up going too far. When they didn't intend for the look back for somebody who had had a prior misdemeanor or felony, not conviction, but charge. They didn't mean it to go back lifetime, but it does because there's no statute. So if you're convicted of aggravated drunk driving, there's a 15-year period on that. But if you were twice charged with misdemeanors that were dropped, you would then have to go in front of a judge. So they realized the error in that it happened too late.
Right.
So there's going to be a solution next year. We're looking at possibly doing a magistrate system, which is a really good way to have people go talk to somebody and be in front of somebody who can have good consistency across the state. And we need consistency for this because, just because you're accused of a crime doesn't mean that you're guilty of what you were
Right.
accused of. And we need to make sure we're balancing public safety with those individuals' rights. So, we take
but-
that seriously.
Yeah, being accused and if you're accused of a crime, I think is different than catching somebody and doing the crime.
Well,
And that needs to be,
and repeating that same
crime.
same thing that you're accused of. So you went out and you beat up your girlfriend, they put you in jail, you went out and then you beat her up again. And then they're going to release you again?
Right.
I mean, that's actually more of a prosecutor problem because they shouldn't be doing that.
well, that's what's happening in California and even in New York where, I mean, and what in California, they raised the,
In San Francisco, you can steal up to just under $1,000
Right.
and nobody can do anything about
Right.
it. So
And
you go
that's-
grocery shopping and just walk out the door with your cart.
right. And now, like most of the Walgreens in San Francisco are closed because of people stealing. And now people can't get their medicine because there's no pharmacy closed. And because they're not charging, and we had a case, I can't remember what the bill was for that same thing for teenagers, juveniles,
Yeah.
of not charging them with anything. So wait a minute. So we hire juveniles to do the crimes for us because they're not going to get charged, and that's what's happening. They notice in California, they're selling stuff and people are getting it from them and selling it on the internet. So anyway, hopefully this sort of ends our year. We'll maybe come back sometime to tell them what maybe we're going to be doing next year and what bills are coming forward, and hopefully maybe when we get a redistricting.
That would be nice. I'd really like to know well, I'll probably be in CD1, but I'd like to know who I'm going to be able to vote for.
Right.
So this has been such a pleasure doing this with you, Ralph.
Yeah,
Serving
you
on
too.
education with you the first
Start with-
year.
and now that you're going to HHS, we got two veins here to cover.
Absolutely, more perspective. So I just hope all the hard work that we did doesn't die on the table, and I hope we're really able to deliver on all of this for the people in New Hampshire.
Okay, so
Thank you.
thank you, and thank you for watching.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.